This is Heidi, and you have found your way to the Yes Yoga system. And we're going to be doing Yes Yoga Balls and Bodywork Pregnancy Toolkit. It is for both students and teachers. Teachers, if you teach pregnancy classes and you would like to add a little extra piece of comfort and ease into the practice for moms and integrate them actually into the classes or have them as a separate class, using the TheraBalls is a fabulous way to have it safe and feel great for your moms. And moms, if you found your way to this particular video, you're gonna just love how you feel as you do the movements and when you're done. So check with your healthcare professional and make sure that it is okay that you're doing this particular routine with me. So let's begin. All right. So we went over how to inflate the ball, so find your way to that because it really makes a difference between the sizes. All right, here and here. We did the cat-cow pose and figure eights and infinity and wave motions in that other video. And now we're going to do some hip mobility exercises. So in the last one I mentioned that you can use, if it bothers your wrist to be on all four, a little elevation at the heel of the hand sometimes makes it more comfortable. So feel free to use that. And if you find that having your on all fours and the tops of your feet bother you, some people find that a lovely little towel roll under their tops of their foot really help too. So those are just some suggestions, moms and teachers. Okay, so my ball is not deflated because I'm not pregnant. But if you are pregnant, each trimester you could accommodate that movement, and you'll notice that it's kind of mushy, which is great because as you get bigger, it'll accommodate them. If you need to remove some air, I often suggest using a spoon and taking out the stopper. And I'm going to use my ball here because I'm not pregnant, but it's exactly the same exercise. So remember to breathe and don't hold your breath. There's lots of different breathing, but for now I'm just going to ask you to just breathe comfortably. Okay, so we're going to be on all fours. And whenever I get on the ball, I'm always doing kind of spinal movements, kind of ironing out the spine, getting used to the ball. Making sure today I feel like I'd like to be on the ball. Making sure it's not punching my belly as I showed you in other videos, and doing cat-cow and wave motions and infinities and different kinds of movements. Just play and have fun. Okay, from the position of the spinal mobility exercises on all four, I'm also going to do hip mobility. So I'm going to place my ball, and it's going to be for moms just to keep it really close into the center of your body and make sure that you're resting the ligaments of your pelvis right on top of the ball just for a few moments. All right, we're going to bring it out a little farther here in a moment, but this is just a gentle movement. It's lovely how it moves along the pelvis. It's nice at how it supports the pubic bone, and the lovely breath that comes and goes is really very nice. So it feels easy, and it should. Okay, as you move into more and more weeks of your pregnancy, you'll want us to keep the ball closer to the center place so that the belly is supported and that you're not overstretching your groin ligaments. All right. But let's say you're starting out and it's your first trimester or your second. Again, you have to see how you feel. I just took the ball and I moved it a little bit farther away from my center. And now I'm reaching the center of my pubic bone, the center of my pelvis. I'm going to rest it on the side of the ball as I stretch my knee outward. Okay, and this is a simple movement. This is basically all we're going to do. It's a lovely movement. It's the mobility of the hips. I'm going to bring it up, my knee up towards my armpit, out to the side, and then I'm going to roll my leg straight, top of my thigh, and I'm going to move through the top of the thigh. And again, you can adjust the ball inward or downward or upward, closer to the center of your navel. It really varies between your comfort, and the farther the ball is away, the little bit more challenging it is on certain muscles, so it's not necessarily better or worse, it just is a little different, okay? So bringing it out to the side, and that feels far, so I'm just going to adjust and bring it in, stretching, bringing the knee towards the armpit, out to the side, and down, using your breath. How do you know you're doing it right? Because it feels good. Nice. Out. Breath. In and out. Maybe once or twice or 3 times in each direction, or just make a flowing motion, a breath in each place, a movement in each position, and then come down. Okay? And then come back. I often like to come back and roll through. See how it feels. No back pain, no neck pain. It should feel really nice. Don't underestimate even that little movement, whether you're fit or you're new to movement. It's all very, very deep as we move along, okay? Once again, I change sides. I'd like you to change sides with me. And you don't have to move the ball to the other side. I just want to demo it. So once again, I don't know where the ball goes. I'm going to take my first shot. I'm going to keep it pretty close into my center so I don't have a lot of movement, and I'm just going to roll to the side. And I know it doesn't look like a lot, but if you're on the ball, you could already tell that something's happening. Using your breath back and forth, okay? If it doesn't feel good, don't do it. And then you can bring it out a little farther. See what that's like. Okay, too much, too little. No strain on your belly, so you might want to bring it back. That'll support it. And then you want to bring it up towards your armpit, out to the side, and then straight down. Simple. Adjust yourself. Use your wrist pads or ankle cushioning. Adjusting the ball. Usually I find a spot that I like and I don't have to move the ball too far each time. I go to different spots. Under the armpit, out to the side, the leg is long. Using your breath, inhaling, exhaling. Sometimes I rock for 2 or 3 breaths in one position. Each one in and out on the side, back and forth. In the same position, using the breath a few times. Coming up towards the armpit, I notice I just move my arm up a little bit, my hand, see if you like that. And then other times I do out to the side, down along the front of the thigh bone, the leg, out to the side, and in up towards the armpit. And I'm always adjusting just enough. An inch or 2 makes a lot of difference. Using your breath. Always feel free to turn off the video, try it out, and come back and join me. But we're going to just be complete now, going to the end. I call it sort of erasing and integrating the movement. Take a moment and feel right in the center, your neutral. And finding neutral is a moving through for me. Backwards, cat, centered, just right. Really, I'm going to just adjust a little bit. Okay, got it. Watch that neck. Forward, slight extension, and then back to center. Okay, moving right along. Come to Yes Yoga Systems, grab the handout. Give me your feedback, teachers and students. Make sure you check with your healthcare professional, and no neck pain, no back pain. If you feel nauseous rolling on the ball, then just don't do it. Thank you very much.